Okay, welcome. This is the Quarantine Survival Experts group, and first I want to just say thank you to Julia for setting this up and inviting me to speak. I'll do a little introduction. I may wait a few minutes just to see if anyone hops on, but I'm going to be talking about breathing today. Tom DeVitro just popped on. All right, so we got a couple people starting here, so I'm going to just, I'll get started. I'll introduce myself. My name is Chris Slibe. I'm a licensed physical therapist, doctor of physical therapy. I'm also a certified strength and conditioning specialist. I own two businesses, but they're basically hybrids. You know, they work together, but two separate businesses in the same location in Ardmore, Pennsylvania. So I've linked my website in the notes. I've also linked the presentation notes for what I'm going to be talking about today. And then I also have notes for, I recently published a book, so the audio book, and then the Amazon link, so you can get any format that you want. So that's all in the notes. And then I have an app there, which I find very helpful for what I'm going to be talking about today, which is breathing. It's called iBreathe, and it's basically just an interval training timer for different breathing strategies. I'll go over some of those towards the end of the presentation. All right, so it looks like we have quite a few people that are joining on. So if anybody has any questions as we go through, hi Shannon, just let me know. Hi Julia, Danielle, looks like my mom joined. All right, so if anyone has any questions, just let me know, and I'll stop where I am in the presentation and address your question. As long as I see it, I'll try to keep my eyes on both. All right, so first thing we're going to start with breathing. So I wasn't able to share my screen, but the presentation notes should have images that work. So if you go to that presentation note, there's hyperlinks that get you to images. And we're going to talk about simplified anatomy and the mechanics of breathing first, because if we understand the anatomy, if we understand the mechanics, we can understand things that might seem a little esoteric about breathing, like because it's so subtle. And we understand things like posture, which, sort of people talk about them in all different ways, but we might have a better understanding of why certain postures are advantageous for certain things. And I want to make it clear that I'm not really talking about breathing in the right way. I'm just going to talk about breathing in the mechanics of breathing so that we understand how to have more variability of our breath and how important that can be for things like pain, which is what I deal with mostly, but very closely linked to that would be emotional stress. So we're in this quarantine situation now, and it is a major change for everybody. And no, I don't think we've ever been in a situation like that. So with change often comes stress. And if we have a little bit more variability of our breath, we can have a little bit more flexibility, can be a little bit more robust in how we handle situations. So that's what I want to get across today. When Julie asked me to speak, the first thing that came to mind was breathing, because it is such a keystone of what I do as a physical therapist for movement, but that also carries into how do we control our emotions, and then how do we control pain even in our nervous system. All right, so I'm going to bring over a skeleton because that's the best way, I think, for me to go over this anatomy. So my children call this Joey. So this is Joey. All right, and we're going to focus mostly down in this region when we talk about anatomy, but I will, if you're following along with the notes, the first thing to look at with breathing is the upper respiratory tract. I'm not going to go into too much detail about that, but it is important to just know that when we breathe in, typically it should start in the nasal cavity. So if we're taking a relaxed breath, we want to likely breathe in through the nose. And then we go down into the pharynx, down into the larynx, and then the lower respiratory tract would include the trachea or windpipe, bronchi, and then into the lungs. And we'll talk about how that's all related to when we get a little bit lower and talk about some of the musculature of the respiratory diaphragm and the pelvic diaphragm and how that all connects. One thing I want to bring up about the nasal cavity, the pharynx, like the upper respiratory tract, and how that matters from a practical sense is if you are a mouth breather versus a nasal breather, that can matter quite a bit when we're looking at trying to relax and how stressful we're going to just be at rest. So if we think about the idea of just letting air or an oxygen in through our nasal passages, it's a smaller hole to let things in, which is a good thing, because when we're looking at trying to control stress, we want to be able to mitigate the amount of air coming in. We want to slow things down. So if we open our mouth and we pull in, it's a bigger hole, so we get more air in quicker, and we have to deal with that. And that can be actually stressful if that becomes a common pattern for us. When we're exercising and we need some extra oxygen, that can be helpful. But if that becomes our habit and we do that when we're at rest, it creates a scenario where we might actually be a little bit more stressed. The other thing is just opening the mouth can have a different effect on how we use our muscles. And I'm going to talk about accessory muscle breathing or accessory muscle inhalation later, and what muscles are involved with that. But opening the mouth and breathing in that way can lead to more of an elevation of the shoulders and an arching of the back, which also can lead more to a stressed type of breathing or hyperventilation. All right, so that's all I really want to touch about on the upper respiratory tract. In the larynx, there's something called the glottis. So this is something else that can be important, which is basically like folds around your vocal cords. So the sound that we make when we breathe can be very helpful if we want to change our breathing style. So the more open the glottis is, the less sound there will be, and that's more normal breathing. If we make a whooshing sound, for instance, then that's a slight closure of the glottis, which can actually slow our exhales down, which can be helpful. If anyone's ever heard of the Valsalva maneuver, that would be a almost complete closure of the glottis. And that creates a lot of pressure down lower, which can be really helpful when we want to be strong. But it's not a great thing if we want to do things for a longer period of time, or if we're doing that routinely just to do things that should be a bit easier for us. So we want to be able to be aware of that area, and that usually we feel it somewhere around, the windpipe area and the throat. But that has to do with just different sounds we might make when we're breathing, which can be helpful. And we'll talk a little bit more about that for different styles of exhalation. All right, getting into the lower respiratory tract, we'll just sort of talk about where the lungs fit in here. So for anyone who's in health and fitness, this is very easy to know, but it's just, we're going to be right in the region of the rib cage here. All right, so we're looking at the lungs as sort of two bags of air that they fill up passively in many ways. So they're going to have an effect, or they're going to fill or recoil based on what's happening lower in the diaphragm typically. So we'll start with our kind of anatomy discussion with the respiratory diaphragm, where there's pictures in the notes. But if we want to look at where that is, we got the lungs up here, and then we have the respiratory diaphragm, which is going to be a dome shape, or it can get peaked when we exhale, and that's going to be a separator between the lungs and then the guts down here. All right, so the viscera, the internal organs. And then down lower, when we see in the pelvis region here, at the bottom, you'll have a hammock, and that would be the pelvic diaphragm, which is just some musculature down there that's very important for many reasons, what we'll talk about. But I want you to think of them as two kind of opposing diaphragms. So again, the respiratory diaphragm, if we were thinking about where it is on our body, would be right on this arc of the rib cage here, and it's underneath, and it goes from the front and wraps all the way around to the back. So it's circumferential. So when we inhale, what's happening is the middle of that diaphragm is going to drop down, and that's going to push down on the guts through here. And then if we're in a good position, we should feel pressure of the guts moving down into that pelvic diaphragm. So this skeleton is not in a great position for those type of breathing mechanics, because if I put this straight line right in the middle of where the respiratory diaphragm is, it is in front of the pelvis, so it's not able to go through the middle of the pelvic floor. So when we look at things like posture, hear words like posture, that would be one thing that I would think is important. That doesn't mean we have to be there or want to be there all the time. But if we are in a position where our respiratory diaphragm is able to be right over our pelvic diaphragm, that means we're in a better situation to breathe with less effort. Because what we get is this movement of the respiratory diaphragm down into the guts. That creates pressure down into the pelvic diaphragm, which creates like a little bit of a trampoline effect. So we are able to drop that pelvic floor down on the inhale, and then on the exhale, there's a natural elasticity or momentum that brings it back up in a restful exhale. So we don't have to actually work that hard to pull things up. So posture really matters there, because if we're in a situation where we're a little bit forward like Joey is here, then we're going to be kinked in that relationship with the pressure going down. All right, so that's what that relationship's really important. And as a therapist, I'm always trying to look at how can I restore that position for people, or at least let somebody understand that. And again, that doesn't mean that you want to lock yourself into that position, but you can feel the mechanics of breathing much better, and then ease of breathing much better when those two areas are stacked. All right, so later on when we talk about some actual exercises to do for breathing, I'm going to touch on different sitting postures with breathing and how one might be more advantageous for feeling certain areas and how another might be more advantageous for feeling another. All right, so the general idea here is that this inhale will drop the diaphragm down. When that drops down, now the lungs can fill. There's space for the lungs to fill up. So the lungs filling is sort of passive to this active contraction of the diaphragm pulling down, gets out of the way of the lungs, makes space here so that the lungs fill up. And then it creates a smushing effect on the guts. And this is where we get this idea of belly breathing. So we're not really breathing air into our belly. What we're doing is we're creating a 360-degree smush of the fluids in our guts. So that's going to go forward, out to the side, into the back, and then down into that pelvic floor. And again, so then on the exhale, you can get everything to recoil and go in the opposite direction. All right, so understanding that, now we can look at the difference between a more relaxed or a passive exhalation versus a more pressurized exhalation. And that's going to be the difference between if we want to let our body rest if we're in a state of stress, or if we actually want to create some muscle contraction that would help us be stronger and guide our muscle contractions, which we can think of in the lines of hearing the term core stability and how we bring some contractions to our middle. So as mentioned before, with the exhale, after you get that downward smushing of the guts and you get that trampoline effect of the pelvic floor, there should be sort of a natural recoil without much effort of that pelvic floor coming up, because the pelvic floor as well as the respiratory diaphragm are both voluntary and involuntary, because if they weren't, then we would have to think about breathing and we would have to think about holding in going to the bathroom, incontinence. So there is a natural response to these movements. So if you're in the right position, they work better and they don't get as stressed. But if we want to add a little bit extra to that, so thinking about the idea of stabilizing the core, or a term called core bracing, which I have in the notes, and I have a reference to where the original idea of that came from in 1957. So just to talk about what that is, we have the ribs here, all right, and then we have the pelvic floor, which I've alluded to. So when we inhale, we want to try to get this idea of a widening of the ribs, because the diaphragm is widening by dropping down. So my ribs here, or we can call these the bucket handle ribs, the lower ribs, because when I breathe in, they move like outward, like two opposing bucket handles moving out. I get that pressure down. So now on the exhale, I can actively pressurize. So we talked about the glottis pressurizing an exhale. Up here, we can use also our lips or our teeth just to slow the process of the exhale coming out. So I can hiss, I can breathe out through pursed lips. But as I do that, I'm now engaging muscles that pull the ribs down, which are mainly the abdominals. And then on the back side, we have muscles that'll pull the ribs down here, which will be some of the lower back muscles and quadratus lumborum through there. So we get this idea of everything widens and then everything narrows, but when we narrow it, we tighten it up. All right, and that gives us sort of this neutral, balanced contraction of the middle. And that would be oftentimes optimal when we're trying to lift heavy weights and we want to move our limbs around our trunk, and our trunk being stiff. All right, so that would be called core bracing. We have to pressurize an exhale now, so we add more exertion basically to the exhale, which is not restful. So if we're doing that on a regular basis and not just during specific exercises, that's a problem. So if we're tightening our abs basically with every exhale out, that's not what we're looking to do. But to be able to do that is very important. Okay. So again, let me know if anyone has any questions as we go through this. All right, so that would be then understanding core bracing. So now where things like lower back pain come into play is on the inhale, if we can't breathe down here well, and we can't create this expansion in the lower belly, then what we're going to be left with typically is an instability in the lower back. So we'll kind of leave this area exposed because we can't get that pressure down there, and that pressure, that intra-abdominal pressure created by the guts kind of smushing and pushing out is some of the most stabilizing forces that the lower back enjoys. And there's some research on that, which is important. Now on the exhale, if we can't learn to engage our muscles and draw in while we're doing more strenuous things, we may use a strategy where we arch our back and then we create more compression, just the bones coming closer together. And if we do that over and over again, that can create more problems. It's rarely the case, however, that the bones are actually touching. It's just that they're getting closer together. There's too many other things in the way that the bones are touching, but the imaging can be helpful to understand, what direction you might be moving. So if you can't create that 360-degree pressure inward and that muscle contraction when you need it on an exhale, then that also can leave the back exposed and less stable. That also then brings us to the idea of breathing in, not down here. Where else would we breathe in? All right, so we're always using our diaphragm with every inhale, but we can think of it as just like our bicep here, our elbow would have a different range of motion. So I can contract my bicep to about here, or I can contract it through a full range of motion. So if I just keep it tight at the top here, it is on, but it's not really going through a full range of motion, so it's going to be limited here. So that same thing can happen with the diaphragm, where we have it peaked up at the end of an exhalation. Before our next inhalation, it can start to drop down a little bit, and then what we're going to do instead to open our lungs a little bit is that we will lift our shoulders and we'll bend back, and what that does is it brings the top part of the rib cage up and makes room for the lungs that way. What that leads to is a tightening of the neck, because the muscles that do that, they all attach to the neck and the upper part of the ribs, and then some of the bigger stabilizing muscles of the arms, such as the pec and the lats, will get involved to just try to kind of keep our arms in place while we bend back and lift up. So what we're left with every breath, and this is happening in a small manner, not a great manner with every breath, but if we're not aware of the difference, each breath we take can really be creating more tension in the neck, more tension in the lower back, but it also leaves our lower back exposed because we don't get that movement down and that compression and expansion into the abdomen. All right, so I have the actual muscles that are involved in the accessory muscles there, and that's in the notes, and you can see the pictures there. You can see where everything's attached. It's not that important to go through each individual one, but just to know that the general idea is that the shoulders lift up and the back bends backwards. Now that's also a strategy that connects to stress breathing, because when we're in a state of stress, we can think about it generally this way. There's some threat. Typically our central nervous system, something in the brain gets triggered, and we'll say a part of the brain called the amygdala, which is like your fear response center. That's going to trigger a response, and then the fight or flight system of your autonomic nervous system. So we've all heard of the fight or flight response. That's the sympathetic nervous system response. That starts to create different changes in the body. And one of the major changes is, we can think of it broadly as blood flow rushes away from your middle and it rushes more towards your extremities, so you can be stronger. So that will be towards the neck, maybe up towards the head. It's away from the middle, but it also is more into your arms. So if you had to fight, or into your legs, your big thigh muscle. So if you had to run away, so you get more pump down there, you get more ability to use those muscles, but we deprioritize what's going on in the middle here. And in an acute situation where you have to get away from something or you have to lift something heavy, that's good, because you're not really caring how you do it. You're just trying to be as fast as possible to get away from it. So that can happen, and that can be a very useful thing in a short duration task. But when that's becoming the chronic situation for us, and that's how we breathe on a normal basis, albeit maybe in a smaller degree of what it would be if we were in an actual threat, what we're left with is a chronic condition where we can't stabilize lower, and we're constantly creating a tension in the back and lifting up. So being able to do some work to just get you down into the belly, spreading around in a 360 manner, and then also being able to feel that relationship between the respiratory diaphragm and the pelvic diaphragm can really make a huge difference on lower back pain. And then also, secondary to that would be shoulder and neck pain, because if we're breathing up here every time, then we're going to get more tension in the neck. That can lead to lack of range of motion, more discomfort, and then we'll also get a relationship to shoulder range of motion. So for instance, if I want to reach behind my back, or I want to kind of reach behind me in some way, my shoulder typically needs to be able to internally rotate, and which is moving this way. So I don't think I could show it on this model because it's too fixed, but just the idea is going that way in general. All right. The other thing you might feel some limitation with would be doing a dip or doing a push-up with exercise. When you get to the bottom there, your shoulder needs to be able to internally rotate. If you are in a situation where you can't move your air well through your body, you're going to be oftentimes over squeezing your back in order to get your motion down there, which can then lead to some imbalances in the shoulder. So ideally, we've talked about what's going on down here, but the reverberation up the chain basically is as the diaphragm gets out of the way and the lungs expand, we want them to expand in a front and back manner. We don't want them to just go to the front, or we don't want them to just go to the back. So we want to be able to feel some expansion in the front and back, and that's going to correspond to what movements we're doing with our upper body. So if we are trying to get more range of motion and less pain or tightness in the front of the shoulder when we go down into a push-up or reach behind our back, we need to be able to breathe low first and experience that posture of the diaphragm over pelvic floor. But we also need to be able to move that pressure up into the chest, because that gives us more ability to support an arm going behind the back or coming into the bottom there. On the other side of things would be if we're reaching overhead, or we're doing things where we would, let's see, where am I, cocking the shoulder back, getting into more of an external rotation movement. On the back side of the shoulders, we don't want to squeeze that together. We don't want to have that squeeze, because although it might look initially like we can get farther, what we're doing is we're just turning the rib cage up and we're compressing back there. So in the long run, that actually can lead to some impingement and strain in the back of the shoulder. So we need to be able to, when we go overhead, breathe into the back side here, the space between the shoulder blades, and feel that expand. And we'll do some exercises to try to feel some of these different areas expand with the breath. But the key is, first, before we can even think about what's going on up higher, we have to be able to get that positioning first of this diaphragm over this diaphragm, and then be able to breathe low, and then let that, like we're filling up a glass of water, let that come up and then fill front and back. All right, so that's how, hopefully that makes sense to how things with breathing just are such a keystone to any other movement we do, but also can be the starting point for anyone who's got any type of lower back pain or any type of neck and shoulder pain, just based on the mechanics of it and everything like that. Now, it's not easy to change these things right away, but it is worth the time. And what I find as a practitioner is that I'll get responses that if I'm working on breathing with someone that I breathe all the time, it can't be that important type of thing. And I think that's what needs to be put aside, because anything that's hard that needs to be done oftentimes is hard to change. So you need to be able to be gradual with it. You need to really educate yourself on it and understand that it's not necessarily going to be an easy process. And oftentimes with exercise, what people are looking for is to be able to do more of what they can already do, instead of spending time building on things that they don't do well. And unfortunately, like where things break down is usually where you don't do well, and you lose flexibility, you lose the ability to move as the situation changes, you change with it. So this situation with the quarantine is a good example of that. And it's how flexible can we be in a situation that we don't even know how it's going to turn out still. But that goes to the stress response, but also that goes to the movement response that can lead to some musculoskeletal pain. All right, so I think I covered everything I wanted to cover about anatomy. And I think now it's just going to look at some movements that we can do to try to enhance some of these postures that I'm talking about, some of these mechanics that I'm talking about. All right, so the first thing that I want to look at when I'm looking at breathing, or want to have people understand, is that there are different postures that would promote movement into different areas just based on gravity. So we want to take gravity into consideration as and go with it as it's an assister for moving pressure. So I have this as a model here for kind of what goes on in our body. So if we actually look at what we're made of, we are way more fluid than we are stuff. So we have a lot of fluid that's just running through our tubes, and a lot of fluid within our guts there, and then we have air that's trying to coming in and coming out in the lungs. But if we look at like something like a water bottle, so if I'm upright now, the fluid and pressure should move down to my base. So if I'm in a good position, again, I should be able to breathe easier down. That's not always the case if we don't have those mechanics, or we're out of position, or we just constantly are hyperventilating, so we're breathing in more than we're breathing out. But our posture really matters if we're really trying to think about getting pressure low. So if we go into a situation though where we go, say, more horizontal, so think about a push-up or a plank, now pressure is going to move to our belly a little bit more and to our chest a little bit more. So that might be advantageous if we want to expand the chest, or if we want to expand the belly, for people that are having a difficult time feeling that. But it might be difficult to expand up here because gravity is working to collapse you down. And we've all seen those people. Maybe we're one of those people who, when you get into a push-up position, the lower back wants to sag, the shoulder blades need to come together, and that's just because gravity is pushing you down. So being able to breathe to the front and the back, no matter where you are, is going to be the best thing you can do to stabilize you. But just appreciate that gravity matters, and the position that you're in is going to make it harder or easier. So if you're a strength coach, you want to keep that in mind too, because then you get a sense of, all right, like, this person really struggles with this activity. Maybe it's just because I need to flip them. Maybe I need to put them in a different posture that gravity helps. All right. So first thing we're going to do is look at different chairs. So I'm going to get regular chair here that I can sit in a 90-90 position. Okay. So about 90 degrees at the hips and about 90 degrees at the knees. So when I'm in a regular chair like this, I can be in a situation where I have my respiratory diaphragm stacked over my pelvic diaphragm, but my pelvic floor is not in a great position to actually expand, to accept air, because of where my hips are. And let me grab my pelvis here, my mobile pelvis, just to give a little bit of a sense of what happens at the pelvis when we breathe in. So when we breathe in, we want to think about the bones of the pelvis basically opening up and accepting the guts coming down. And then what will happen at the sacrum here, if you can see that, this actually comes forward, and it's like a little bit of a bottom that comes together. So the bony anatomy is that you're actually just trying to accept the guts up here, but block it from going too far down here. So when we're in that position, our hips are going to tend to be a little bit more out, but we'll also, or we can be like lower in a squat, so our hips will be more externally rotated. When we're at a 90-degree position, which would be about right here, what happens is sort of the opposite, is where the pelvis starts to come in a little bit, and this is going to be a better position to promote the exhale, the feeling of the pelvic floor coming up or the belly button moving in, maybe a little bit of bracing. But the idea is to think about an exhale generally as things are compressing towards the middle. So we're sort of in if we were thinking about a squat pattern, we're like in a mid-range here when we're sitting at this 90-90. So that's going to be where our muscles have to work the hardest. And then that becomes a place where we're going to have to use our muscles more. So whenever we are sitting in this chair, it's not going to be the best to feel an inhale low. You can still do it. So I would focus on maybe breathing into the belly, breathing into the lower back. It's going to be hard to feel that expansion low into the pelvic floor. But on the exhale, it's a good opportunity to feel belly button coming in and pelvic floor coming up. So it's like you're feeling your sit bones rising away or kind of moving, I guess, towards each other would be the sense. But what you'll feel is an upward movement in the center and then your legs should get a little bit heavier. All right, so if we move up from the middle, that means that everything kind of below that should get a little bit heavier, and that would be the sensation there. And then the next inhale, you just try to breathe into the front, breathe into the back, just try to keep it low. If you notice that you're doing this, you actually have to breathe in not deeper, but in a quieter and a more controlled manner. So the idea of taking a deep breath will give you a little bit of diaphragm, and it's going to give you a lot of this. So to get your diaphragm to contract lower and not come up, it's actually got to be a smaller inhale and a quieter inhale. And just feel the beginning of the expansion. As soon as you feel any movement down here, I would just stop and hold, and then let the exhale be a bit longer. So belly button comes in, pelvic floor comes up, and see how long you can go on the exhale before you need your next inhale. So the inhale will be nice and small and quiet. As soon as you feel something moving up, just like let the shoulders drop, stop and hold what you got in the belly, and then bring it back up. Okay, so this position, better for feeling the exhale pull things together. All right, not as good for feeling the opening and the lowering of the guts, if you will, or that trampoline effect of the pelvic floor during the inhale. So if we do want to get to that, there's a couple different options, and it really depends on your range of motion. So if you can get into the bottom of a deep squat, that's a great position where you're actually putting your belly on your thighs, your hamstrings on your calves. But I'm going to assume that some people can't do that, so we'll make it a little bit easier. So that's what these meditation benches are for, oftentimes, and there's two ways to look at it. So if you can get into a position where now your hips are quite a bit lower, or your knees are quite a bit lower than your hips, this is a bit easier now to feel the downward movement. So your inhale is able to create a little bit of pressure down, a little bit of opening between the legs there. And then the exhale might be a little bit harder to feel the up, but you could still feel it. It's just that now this might be a little bit more biased towards inhalation. And then if we can sit cross-legged with, again, our knees lower than the hips. So I have my butt elevated because if I sit on the ground, my knees have to be up here. And unless you're quite flexible and you can get into a lotus position, you're usually going to want to elevate so the knees are down. But now I'm into a more externally rotated position of the pelvis, and that allows for a better inhale as well. So I can breathe down through here. Okay. So again, I alluded to it before, but breathing is really your posture more than any type of actual position. So for instance, if you're pulling yourself into what you think is the right posture, but you can't breathe into the front and back, and you can't breathe all around, you're not in a very good posture. All right, and this happens all the time because we think that we're supposed to be in some, upright line, but we're not thinking about if we can actually breathe there. So what happens most frequently when we pull ourselves into good posture, or what we think is good posture, is we just squeeze our shoulder blades together, push our chest out. So that makes us not be able to breathe into the back. We can breathe into the front of the lungs, but we're also likely pulling our ribs up and going closer to that accessory breathing position. So whatever posture you're in, just see if you can create the same breathing. Can you breathe down and low? Can you expand in a 360-degree manner? And then can you exhale in a way that sort of brings everything back to the center? And if you want to relax, the goal would be to be able to take more time between inhales, basically. So there's many ways to do that. The easiest way to think about it is to just take a longer exhale. But also, if you're taking a slower inhale and you can hold a little bit after the inhale and everything's low, and then you can take a slower exhale, and the exhale takes less effort, then you're going to be closer to resting. More effort, obviously, would be more stress. And that's not always a bad thing if we're trying to be strong, but it's not a great thing when we're trying to actually feel like we're trying to chill out. All right, so that would be just a general idea of how to use different sitting positions and different hip positions to enhance whether you're looking at more inhalation mechanics or exhalation mechanics. And again, feel free to stop me. I don't see any specific questions yet. All right, so then if we're going to look more now at the chest here, which we can also think of this as, I talked about bucket handle mechanics here. This would be like a pump handle here, and then a pump handle in the back. You'll sometimes hear that referenced, and it's just because of what a pump handle would look like. This just goes forward when you take a breath in the chest, and then this same thing on the back side. So if we're going to look at the front side pump handle mechanics and just understanding what I was talking about with tipping of gravity, we're going to look to put ourselves into a quadruped position first, which is just going to be hands and knees. And we want to look at wrists right under shoulders, knees right under hips. And the inhale now, we want to see if we can still fill the belly, still breathe into the lower back so we don't let things drop here. If we can feel it into the pelvic floor, that's great. It's just not a great position to feel it there. And then when we exhale, we're going to want to pull the belly in, and we want to think about bringing the ribs down. So the ribs on this side, if we would just think about like compressing them in as the belly comes up and holding that with a little bit of tension. So we have a mild abdominal brace. The next inhale, we try to breathe through that brace into the chest and just see if the chest can move to the ground. All right, and here's a good time to just hold your inhale. So you breathe in for a couple seconds, but hold it for another few seconds just to see if you did move into the chest or did you move up into the shoulders. And then the exhale will pull in more, draw the ribs down more without any loss of posture. Okay, so you inhale. Can you feel that chest move to the ground? You also want to see if you can feel the space between the shoulder blades moving up to the ceiling, but gravity again is going to assist more of the front side here. Okay, so that would be looking at where I would start with a lot of people with just trying to feel the expansion into the chest, and that would be maybe corresponding to some shoulder problems with push-ups or reaching behind the back, etc. And then if we're going to look at getting the back side, what we want to do is go against a wall, just so we have a reference. Let's see if I can get myself in here. So we just use the wall right next to my Jack Bauer 24 picture here. So I'm going to try to feel the whole spine against the wall. All right, so I want to feel the lower part of the sacrum, which is right here. So the base here. And then I want to basically try to feel as much of the spine. You can see the relationship here of shoulder blades are out here, and then your spine runs through here. So the closer my shoulder blades are together, the less of this is going to be on the wall. So I don't want my shoulder blades to come together. And that is hard for people when we're looking at working on things with the shoulder, because we think that's the position we should be in to protect our shoulder, but it's limiting your range of motion, and it's definitely limiting your ability to breathe back into that area. So I have the whole back on the wall. The knees can be a little bit bent, so let me tip this down. You can see my knees. So they're a little bit bent, but not squatting, just feeling that it's easiest to put the whole spine on the wall. If the head can touch, that's great too, but prioritize the spine being on the wall before you put the head there. And then what we're going to do is create a low reach with the palms up. So I'm going to just try to reach my fingers away from my shoulder so I get more of the spine on the wall. And then when I inhale into the belly, but also now when I really focus on breathing into the back, start low and see if you can get it up into the space between the shoulder blades. Exhale, you pull in, pelvic floor comes up. Don't lose the reach. So when you exhale, you don't want to pull your shoulders back. You just keep the idea of reaching the arms long. Next inhale, maybe you get a little bit more expansive. The shoulder blades are moving away from each other. Exhale, pull everything in, ribs down. When you exhale, it moves you more into the wall because now the belly is moving inward. So that means your back is moving more into the wall. Then the next inhale, it expands you more. So we're just focusing every breath, whether it's inhale or exhale, is moving you more into the wall. And we want the shoulder blades to actually move away from each other and open up. So that would be the posterior expansion. So just being able to breathe up higher, that's going to correspond to movements when we go overhead or like throwing a baseball where we have to cock back. All right, so that would be just the different body postures that you might look to do if you're trying to tie in some of those mechanics. Okay, so on the outline I gave you, there's also box breathing, 4-7-8 breathing, and 30-30 breath holds. So really quick, what they are, they're just using different counts to be able to extend out your breath a little bit longer. All right, so if there's one thing you take from this, just if you want to relax a little bit, you really got to get better at taking more time between breaths. And first thing to do is just being mindful of that. Being mindful of, how am I breathing right now? Can I take a little bit longer exhale? Can I take maybe a smaller or a lower inhale? So just that mindfulness and noticing if it's hard. If it's hard, well, at least you've noticed it's hard, because most of the time with breathing, it's just a matter of like, we're just in our patterns because we're doing it anyway. So that's why mindfulness and the idea of mindfulness is so important, because it allows us to know what we're doing, and then we can be more in control of our shit, basically. So that's how we're going to look at it. So breathing is the way to get there. And it's oftentimes the thing that brings us into our calming our nervous system down, but it's also the starting point for most movement dysfunctions. All right, so the 4-7-8 breath, which is a technique from Dr. Andrew Weil, is just basically inhale for 4, hold that inhale or retain the inhale for 7, and then breathe out for 8. So your inhale is 4 seconds, and then the retention and the exhale combined would be 15 seconds. So that just extends the breath out. That could be a very valuable tool for just trying to calm things down. It's also, I use it as an assessment a lot to see how people do with 3 parts of the breath, 3 phases of the breath: the active inhalation, the retention after the inhalation, and then the exhalation. And that retention after an inhalation could be really valuable, because you can see where people inhaled into, and as they're retaining, that's where you can actually make some adjustments. So you can think about when you're retaining that inhale, that 7 seconds, the diaphragm has dropped a little bit, so you're doing an isometric contraction for the diaphragm. You're getting it stronger, if you will, but you're also teaching your body to observe where it is. So that can be very helpful, because sometimes just thinking breathe in, breathe out, there's not enough time to feel the inhale move down. And if you try to take too big of a breath too quick, it just goes up. So that can be very frustrating. So this 4-7-8 breath can really help with that. The 30-30 breath holds I find to be very helpful, just at getting you to be less sensitive to the feeling of not being able to breathe in. All right, so instead of making it too confusing, like where you're breathing, just the idea of staying relaxed and being able to hold your breath longer without the urge to breathe makes it much easier than to go and do any other breathing exercise where you need to slow your breath down. So the 30-30 breath hold would just be, you're relaxed, you pinch your nose, you see how long you can hold your breath for before you get a mild feeling that you need, or mild to moderate feeling that you need to breathe in again. And if it is 30 seconds that you've made and there's no problem, then you get a 30-second break. So it's a 1-to-1 ratio of basically work to rest, which ties into kind of building up the aerobic capacity of that breath idea. If you're new to the process and you struggle with it and say you only get 10 seconds, well, then you get 20 seconds extra of your break. So it ends up being a 10-second breath hold and a 50-second break. But as you get better, so you can go 15, then it's 15-45. And the goal would be to just get yourself to being able to do 30-30s as a maintenance program that it's very easy to do. So what that helps with is you desensitize to carbon dioxide buildup. So the idea of feeling like you need to breathe when you're holding your breath is there's carbon dioxide building in there. And we have way more capacity to tolerate that than we usually feel that we do. So we'll feel like we need to breathe in way quicker than we do. And if you train that, you can see that you can hold your breath for 30 seconds to a minute pretty routinely just from practice. And that helps you when you're just at rest, not feel like you have to take a big breath in or a big breath out, but your resting breath is a little bit more indiscernible, where it just feels like you're just being. And that's one of the most peaceful places to be. So I find that to be very valuable. It doesn't feel very comfortable when you're new to it, but if you get better at it, it actually makes the effort of breathing a lot less. And then the box breathing would just be the 4 phases of breathing. So there's inhalation, the retention after the inhalation, the exhalation, and then the retention after the exhalation. So you just breathe in for, let's say, 4 seconds, hold for 4, breathe out. So you're actively compressing for 4, and then you just hold that compression for another 4, and then you just cycle through that. That's most of those are on that iBreathe app that I linked in the notes there. Okay. Otherwise, that's all I have. So if anyone has any questions, please comment. But yeah, I just want to thank Julia again. This was a great opportunity. Hope everybody stays safe. I'll stay on for a little bit longer if anyone wants to ask questions. People that know me, they can text me. Thank you. Thanks for watching, Kevin. Appreciate it. Thank you, Ann. You rock as well. Love what you're doing. Thank you, Mom. Oh, good. We got Crystal, who's a pelvic floor therapist on here, so she can call me out if I misspoke, but she can tell you how important breathing is, and she works specifically with that population of just pelvic floor, and just how important the breath really is the driver there. Okay. All right, Shannon. Thank you, Julia, for having me. Thanks for making me a part of this. All right, so if there's no specific questions, I'm going to sign off. Everybody enjoy their weekend, whatever that means in the quarantine. See you later.